Welcome back to my channel. I have two friends this time.
Hi,
I'm not
guys.
alone after all. You've met them both before. You've met Nausheen in my lecture video.
Hello.
And Yalda in our most recent video. See, so we're back. So people have been like asking for various videos. One was how we have studied for OSCE. So we've just finished OSCE practice because we're keen beans. And our finals, I don't know if you guys knew this, our finals are in 85 days.
Oh my gosh.
Do you know when you do the past mid countdown? 85 days till finals. But
Thank
then
God.
it's written, so.
This is why I never put the date on the first one.
It's honestly, like when you see it, it's quite like
Daunting.
palpitating.
I agree.
So we're just going to chat a little bit about how we've studied for OSCEs first year, second year, and how that differs from when you're into third, fourth, fifth, some of you that do sixth year, how that differs with our OSCE. So yes, stay tuned to see the rest. So you can follow these two on Instagram. They're going to be Instagrammers. They may or may not accept your follow requests, so make sure you have a nice profile picture. Otherwise, they'll be like, no, this person looks strange. Don't want them to follow me. But yeah, so how would you say you studied for OSCEs for first year? I don't think I studied for OSCEs for first year.
I think I did, but I think I was a lot more panicked and I was very clueless about what was going to come up.
We were just saying, we thought it was so hard. Like, first year OSCEs was the hardest thing in the world.
It's
and
actually
you're like,
not true, because then it was a lot easier, obviously, because it was a lot more straightforward.
so straightforward.
But
I just practiced with my dad and it was great fun. It was very relaxed. And then third year was a different ballgame.
Third year is a complete, like, some people go to unis where they do, basically the first year for your clinical years is always a huge jump. Like we were saying, one of the first year OSCE stations was like urinalysis, dip some urine.
Yeah.
Or did we get blood pressure or did we not get blood
I
pressure?
think we ended up getting
Second year?
Something like that. And it was the most complex thing in the world, trying to hear the sounds and all
Adding
these.
30.
Oh.
But you basically knew what was coming. It was just like
Yep.
a list of like maybe 15 things, and then
Yes.
you're like, okay,
Yes.
There's a list on the portal.
there's not going to be anything random.
It was very finite. So you could, if you had and we had the booklets.
Yeah.
If you knew everything that was in the little booklet, then you
You'd be
were
fine.
okay. So if your uni has a similar thing, you'll be fine. Like first year, catch yourself on, it's gonna be fine.
Yeah.
Then when you move into the clinical years, so third year, or some people fourth year, fifth year, and sixth year, for us it was third year onwards. It's a complete...
You do not know. You do not
You
know.
do not know what's gonna come, so you either like revise as much as possible.
Uh-huh.
You don't skip. I would not skip any like topic.
Yeah, that's good advice.
Just like
It was as if they opened a medicine textbook. Let's say
it
Kumai
was
Clark.
not even
They
medical
flipped,
questions.
they
They were
flipped the
asking
pages.
me about insurance.
I
for
know.
people. I was like, obviously I don't know this. Especially I don't even live here. Like
It's like, I'm not from here. I don't know these things. But I think though the general principles, like don't be hard on yourself. There will always be, for us, I feel like every year there's always a station where everyone comes out of it and is like, I
Yeah.
had no idea. So don't be too hard on yourself. Communicate well, be nice.
yeah.
Most places
I think genuinely OSCEs are 90% about communication.
100, yeah, facts.
Even if you don't know the station at all, you can
Mhm.
totally pass it. As long as like you are like polite
Yep.
and you don't like put the patient in danger or anything, you'll be fine.
Even so at our uni we have this system where they might do like the yellow cards, or basically say, okay,
Yeah.
you did something that wasn't safe, but that doesn't necessarily mean you failed the station or
Yeah.
failed the OSCE. So just do your best. If you go in and you're like, I have no idea what's going on,
Yeah.
no idea what to do, say hello, wash your hands, introduce yourself, check the
the
patient's name
sharps
and date
in
of
the
birth.
sharps bin.
Yes.
Offer a leaflet.
Oh my
Always.
Oh,
Yeah.
always. Here's a leaflet that you should read, that I'm going to read too, so I know.
Yeah. What
And
are other red?
You
the
can
other-
also
red
fail a
flags.
couple of stations and still pass.
exactly.
Yeah.
In our uni anyway.
Exactly.
Yeah.
But I feel like most places
Yeah.
are like that because you're never going to know everything about everything. That's just not
Yeah,
realistic,
I agree.
especially as you're coming forward as the years go on.
Yeah.
What kind of resources were you guys using, or have you guys been using?
Yeah.
In third year, I think I just made a list of topics and was like, right, let's see how we would tackle this, and
Mhm.
then things like geeky medics
Mhm.
or any books that we had, we'd look through and then just talk to other people and see what they would add, and then I just kind of
Yeah, I thought Oski Stop was really good.
yeah.
Yep.
And I tend to use more books rather than like websites.
You have a book, the blue book you have. What's that
Yeah.
called?
Essential Examination.
Essential
I think,
Examination.
By Alistair, maybe.
Something
I have
like
no
that.
idea, but,
Really good.
Essential Examination is a blue book, and it's really good. And yeah, just the Oski Stop and like lectures, like
I feel as though if you have a good knowledge, you're going to be okay. If you want to do well, you need to practice. You need to practice with people.
yeah,
You need to practice actually saying the stuff, actually
Yeah.
doing the stuff in
it's not
in real life.
Oskis are not only clinical stuff; it's counseling. It is I don't know, like explain this medication to someone, or like just like communication stations as well. It's not just clinical.
But yeah, no, definitely in terms of, I feel like practice is really important. We were talking about like we do OSCE practice, and we do it as if it's the actual OSCE. So we have a scenario. One of us is the marker, one of us is the patient, one of us is the one doing the station, and that gets you in a good habit of okay, make sure you always introduce yourself, and then just being in the mindset of OSCE mode, if that makes sense. Also, we're talking about being on the wards. If you're on placement, make good use of your time.
Yeah.
Like go see.
Just pair up and
Mhm.
just go see patients and like mark each other.
Buddy up with someone who will be harsh with you and say, listen, you've missed this out.
Exactly. You need to, I feel like that's really important. You need to, whoever you're practicing with, be like, okay, you know, tell me as it is, be straight with me, just tear me to
Like
bits.
really hard questions.
So Yalda's OSCE stations are, you leave like, have I
Next level.
studied? What have I been studying for the past 4 and a bit years? Have I been going to the same uni? What's been happening?
Torture everyone.
But yeah, no, you really do need to be, because if your friend's just like, oh, that was great, and not giving you any feedback,
You did well.
what are you going to learn? Nothing.
Yeah.
You're going to turn up to
I
the
think
day
it's
and...
seriously need to give each other feedback and just be straightforward.
And that's why I like the mark schemes. Like OSCE Stop does like mark schemes. Also, there's tricyclics for psych.
Oh yeah, that's amazing. I totally forgot. I just found that randomly on the internet one day. That's
And they
amazing.
have like proper
And
scenarios
also
and
for
stuff.
like the X-ray and imaging, there is a radiology masterclass and
And
Radiopedia.
Radiopedia.
But I think radiology masterclass.
It's
You
pretty good,
think?
yeah.
I think so. Which one's that one?
Ooh,
I think
I've not really used the radiology resources, if I'm being very honest.
to be honest, I think they're really good. Like they explain like everything.
That's true. Oh, my radiology, I can spot diagnose really well,
Mm.
and I can present an X-ray. The bits in between, like the really rare signs, are just like,
Yeah, they won't give those anyways.
no, you'd hope not.
They just would give the, like the obvious things. But if you're like in beginner and like you wanna like start learning
Yeah.
and you wanna have like
A
strong
reasonable
base.
understanding.
Yeah.
Mm.
so that's a really good resource.
What else? Almost a Doctor has an OSCE list. It's got like an OSCE checklist where you can go through and think, okay, have I practiced this? Have I practiced that? And this is more like in the clinical years. Third year and final year are really similar.
Yeah.
Fourth year, at least, you're like, oh, they're going to test other things like obs and gynae, peds, things like that. Final year is obviously everything.
Yeah.
But I would say third year and final year are quite, because they're general medicine and general surgery heavy.
Mhm.
So, and make good notes. We're talking about this.
I don't make any notes, which is really bad.
I was like, oh yes, I'm studying for my third year nose, and Yalda's like,
What third year now?
Too late now.
it's too late to apologize.
You can make some notes. Yalda.
Yeah, you can. You can make
It's
some
too
notes
late
now.
What do you do? Just read.
Yes,
But
by osmosis.
Just to take it on. Osmosis is fantastic for just general, basic
But
understanding
yeah,
of conditions.
just making notes is so much easier.
Mm.
So much more.
No, I mean the YouTube channel Osmosis.
Oh, okay.
That is really, really good. I think that's quite good.
Also, like the university does like mock OSCEs and stuff.
Yes.
Yeah.
So I think those are really good.
Go
Sign
to
up for everything.
Sign up for all the mock OSCEs.
All of them, honestly. And we have a really good peer share. I used peer share quite well in third year, I think.
Yeah.
mine
yeah.
was great.
Mm.
Yeah.
Yeah, so just like talk to the seniors and see like what OSCEs came up with them, because they reuse the stations.
They
to be honest.
exactly. Most years somewhere will be something which talks about like the trends. Someone out there is keeping a document of all the OSCE trends or stations that have been at your uni for the past like 5 years, for example.
Yeah.
So if you're in first year, get a final year friend, ask them what came up in their OSCEs. Second year, ask people.
Yeah.
And people is like, I'm not stingy with resources because, like, what am I gonna do?
It's honestly not gonna make a difference if you share your resources or
Exactly. So
not. No one knows what's gonna come up at the end of the day. And
so be generous, be friendly with people so that they feel comfortable to also be like, oh yes, and I've been doing this.
exactly.
When you tell me about something, I'm like, oh yes, and I've been, and just continually helping each
Yeah.
other.
The more you share resources, the better for everyone.
I agree.
Yeah.
Any parting gifts of knowledge? Anything that you'll be like, definite? What are your top 3 things for practicing for OSCE?
Find a buddy who's harsh. Do it regularly, and don't have pre-prepared resources. Just go in and see how it goes.
So
Just
as
do a
in like,
station.
don't come in saying, okay, we're gonna do neurology today.
Yeah.
Just see how it goes.
Yeah.
Okay.
Practice. I
Those
would say
really good.
that, and go see actual patients.
Yeah.
That, like, I would have avoided like seeing patients. I thought like, well, if I study on my own, it's better because I can like see the mark scheme, etc. But nothing is better than going on the wards and seeing actual patients, because those are the people that have signed. And once you see something, you never forget it.
Exactly.
And everyone used to tell me that, and I was like, that's not possible. You always forget everything, but you actually remember.
When there's a story behind it,
Yeah.
and there's a person, it does stick.
Yeah.
I've been saved a lot in actual written exams where I've seen a scenario and I've been like, I met someone that had this, and then what did we do for them, or what did their
And
investigation
honestly,
or whatever show?
common things are common, so
Mhm.
you see like loads of things that are common, and they will keep on coming up.
I guess that's it. That's it, right?
That's it.
Good luck for your OSCEs, guys.
Good luck for OSCEs, guys.
You'll
and
be fine.
And
pray for us.
Confidence is key.
Yes, definitely. And I think that's really
Oh
important.
my God, yes, confidence is really, really important in OSCEs.
And I think that comes with practice. The more you practice with people that are going to be like, okay, you missed this, you become more comfortable
Yeah.
and confident. And the more patients you see, you become more comfortable.
Yeah.
Obviously, don't tell any lies. If you didn't hear something or didn't see it,
Do
don't
not
don't
lie.
say it.
Do not lie.
Just
But-
say I couldn't hear it.
Exactly. But present yourself confidently and
Yeah.
just carry yourself better. It makes the patient feel more comfortable.
Because at the
in
end
you.
of the day, everyone's anxious for OSCEs. Like, it's normal. Everyone has anxiety. But if you seem confident in what you do and try to control the anxiety, it just seems so much better. The marks that the patients give you are going to be so much more better,
Yeah.
because obviously they want a more confident doctor.
Exactly. And that's like, if you're in a hospital and your doctor seems like, okay, they're not quite sure,
Yeah.
you're going to be like,
Yeah.
well,
Yeah.
then...
Yeah. Speak to the patient as well. Don't like make eye contact and like be nice to them.
Yeah.
Like, don't just go like a robot. Be like, how was your day? Just like make calm in the beginnings to like build that
They
rapport.
feel more comfortable. And also don't ignore a lot of so if you're a simulated patient, you've had 20 people pressing your tummy, or 20, like, little things make a difference. So
Yeah.
be that bit more gentle. If you're going to be firmer, warn them in advance.
Yeah.
My hands are cold,
Yeah.
or I'm just going to press a bit firmer. Tell me if I'm hurting you.
Yeah.
Just little things like
Ask
that.
them if they're in any pain before it or something. Yeah, those just small questions make a lot of difference.
True.
Yeah.
Oh, thank you guys. Adios. See you in the next video. Thank
Bye,
you guys for
guys.
coming.
Thanks for having us.
Thank you for having us.
Please do like, comment, and subscribe to this channel. And any video requests, just put them in the comments. Messages on Instagram. Send
Exactly.
an email.
We're always available.
We have finals, but yeah, we're always available. Always available, ready to reply.
After March.
Yeah, exactly. After March, we'll be
Wait a couple of months.
way more available. Yes, no, thank you guys, and see you in the next video.